Good morning, everyone. It is really a pleasure to be here. I was here last year, and I'm glad to be back this year. We do have a very important time that's coming up. As Ms. D said, we have open enrollment. That's October 15th through December 7th. So on today, it's not going to be very long, something boring. It's just to kind of bring you back up to speed about what Medicare is, how it works, and some of the processes. Some of the things that you need to look out for when you're deciding on what you want to do if you want to make changes to your Medicare plans that you currently have. I won't prolong the time, but I don't like the term expert. Yesterday I actually had another presentation I did, and they called me an expert, and the very first question I got, I did not know the answer. I say, so I'm the expert, but I don't have the answer. So that was kind of funny. I'm like, oh my gosh, this is going to go horrible. But it turned out to be very wonderful, very nice crowd. So again, I'm Shauna, and any questions you have, pass them down. Don't make them too hard because I may not know the answer, okay? Again, with Medicare, what is Medicare? How many people actually have Medicare right now in this room? How many people are new to Medicare? Okay, I'll take it a little bit easy for you because if you're new, it's going to take a lot of processing because Medicare is complex and it can be overwhelming. Don't become afraid because you do have SHIP to help you, okay? Medicare, it is our state health insurance. It's for 3 groups of people. Anyone that is 65 years of age and older. It's for those that are under the age of 65 but have certain disabilities, and then anyone that has end-stage renal disease, they can also qualify for Medicare benefits, okay? It's going to be administered through the Centers for Medicare and Medicaid. However, in order to enroll, you actually have to call Social Security. A lot of people are not aware of that. They say, well, I call Medicare to take on my Medicare. That's not where you will have to call. To get the ball rolling and to get things started, you first initially have to call Social Security unless you're automatically enrolled into your Medicare benefits, okay? The Medicare card, they call it pretty much the red, white, and blue card. If you're automatically enrolled, you should receive what they call initial enrollment packet. It should include your Medicare and You handbook for the year that you're eligible, and it should include this card. This card is going to have all of your information on it. It's going to have your name. It's going to have your Medicare number here, which is also going to be your social for just about everyone. If it's not your social, it is somebody's social. It could be your spouse. So this card is very important, but it's also going to have an alphabet that is going to follow it, which is going to tell what your relationship is to the beneficiary if you're not the beneficiary. Typically, if you're the beneficiary, it's going to have the alphabet or the letter A. It's going to show your entitlement dates for a hospital coverage, which is Part A, and your medical Part B. It's going to show the entitlement dates for those. But the most important thing about this card is to keep it protected. Can one person tell me why, or anybody tell me why? Correct. Because it has your social on it. If you lose this card, now anybody has the ability to do pretty much whatever they want. They have your name and your social. So we try to tell beneficiaries, treat this card as if though it is like a credit card. So if you do not want somebody to run up a bill in your name and you don't want to pay for it, then you protect this card. A lot of people are said, well, once I join Medicare and I join a Medicare Advantage plan, the Advantage plan tells me to throw the card away because I do not need it. I do not agree. You may not need it any longer when you go to your doctor's appointments because you will actually supply that card through Blue Cross Blue Shield or Humana because those are Advantage plans. They're going to give you your own card to submit to your doctors when you go to their office. You won't have to take this card. But however, still put it up somewhere where you know where it is because it has your social on it, okay? And then also some people will decide to refuse their Part B, but if you know you're going to keep the A and the B coverage, you keep it. If you choose not to accept the Part B, then you simply follow the directions on the back. It is so small, I still can't read it, so I won't tell you what all the instructions say, but you can send it back and they will basically send you a new card showing that you only have the Part A. But that is going to apply to somebody that's still currently working, but yet they're at retirement age of 65, okay? There are 4 parts to Medicare. A lot of people say, well, what is this? There are only 2 ways to receive your Medicare benefits. The first way is if you're going to go with Original Medicare. The second way is if you're going to go with the Medicare Advantage plan. With Original Medicare, you have your A that helps make up that component, you have B, and you have D. That makes up Original Medicare. And then you have the option of choosing a Medigap policy. Later we will discuss what a Medigap policy is. I did not put it on this screen here because it's optional, but these are the 3 that make up Original Medicare. That's the first way to receive your Medicare benefits. The second way is going to be Part C, which is called the Medicare Advantage plan. The Medicare Advantage plan bundles your A, your B, and your D together in one plan. It's going to resemble a HMO or a PPO, things that, well, the plans that you're kind of used to seeing or networks that you're used to seeing when you have your private insurance while you're working. That's what the Part C is. A lot of people get the Part C confused with supplemental. A Medicare Advantage plan should never be identified as a supplemental insurance, because when you say supplemental, that automatically means when you're talking to me, Medigap, because Medigap is the supplemental insurance for Medicare beneficiaries, but you can only get it with Original Medicare, okay? Some important terms to know. I actually added this slide yesterday, and the reason why, because when I find myself trying to separate Original and Medicare Advantage plans, and I start talking about co-insurances and co-payments, a lot of people are not familiar with these terms. A co-insurance, normally it's going to be associated with Original Medicare, meaning there's going to be a percentage that is going to be tagged, I guess you can say, to the services that you actually receive. A coinsurance is going to be the amount that may be required by you to pay as your share for any cost of services that you receive. Original Medicare is 80-20. That's the split. Medicare pays 80. As a beneficiary, you're responsible for 20%. That's the breakdown. But then you also have a copayment. Co-payments are usually going to be associated with an Advantage plan. Co-payments are going to resemble a dollar amount. So if you're going to your doctor's office, to a specialist, they will tell you a certain dollar amount that you pay, and it may not necessarily be a co-insurance. Usually it will never be a co-insurance, okay? And then you have a deductible. A deductible is going to be the amount that you pay before the plan actually helps you pay for your services. Deductibles are going to apply to prescription drug plans with Original Medicare, and then they will also apply to prescription drug plans with the Advantage plan. But you also have deductibles that are going to be associated with your Medicare Part A, which is the hospital coverage, and they will also be associated with the Medicare Part B, which is your medical coverage. You have those that you have to pay no matter what, okay? If you stick with Original Medicare. What does Medicare Part A help pay for? It helps pay for hospital stays, skilled nursing facility care, home health services, as well as blood transfusions. Hospital stays, this is very important. This is if you are considered an inpatient. If you go into the emergency room and they never change your status to inpatient, and they say we want to keep you for observation days. Observation days are not covered by Medicare. So it is very important that you advocate for yourselves, or you have your spouse or a family member that is aware of that one particular thing, because we find a lot of beneficiaries that do not know. And they say, well, they're going to keep me here for 48 hours. 48 hours under observation or 48 hours as an actual inpatient. It's two different things. You always want to make sure that you're admitted into the hospital so that you do not get stuck with that bill, because when they do not pay for observation days, you're responsible for any services that they provide, any medications that they give you to continue to manage your health conditions while you're there. They may give you aspirin, because that's what you take when you're at home, even though you're not there for anything dealing with your blood or what have you. But they're going to charge you for it, and now you have to pay that money for it. And it's not going to be shared by Medicare because it's observation. That's one important note to remember about Medicare and Part A and hospitalization or hospital stays. With the hospital stays, you're going to get meals, general nursing. You're going to get critical access hospitals that you can go to and receive services or care, and Medicare is going to cover a portion of that, as well as inpatient rehabilitation facilities. Those are going to be covered as well under your Part A, as well as inpatient mental health care. That will be covered under your Medicare Part A. On the skilled nursing facility, Medicare is going to help pay for skilled nursing and rehabilitative services, and of course any supplies that will go along with those services that you're receiving will be covered. Home health care, whether it be part-time or intermittent, it's going to be covered. That can include speech pathology, physical therapy, those different things. You fall, you break your hip, now you have to go to a rehab. You have to have home health services or any kind of rehabilitation that's going to be done in your home. That is going to be covered by Medicare. Blood transfusions, of course, if you're an inpatient, you're going to get the first 3 paints at 100%. Medicare is going to cover it. You do not have to worry, but after the first 3 paints, every paint after that, you're responsible for 20%. Unless you have someone that is donating that blood to you, then of course it's at no charge to you at all. What you pay in original Medicare for hospital stays. Remember, I said there's always going to be a deductible that is associated with your Medicare Part A. The deductible for the Medicare Part A, if you are admitted into the hospital, is $1,216. And again, these totals are for 2014. I don't have the totals for 2015 yet, but that $1,216 is per benefit period. A benefit period is 60 days. So if you go into the hospital on day 1, you are released on day 3. You go back on day 6. Day 6, you will pay another $1,216. The only time you will pay $1,216 once is if you are in the hospital consecutive 1 through 60 days. Anytime you go in and come back out, you start a new benefit period. A lot of people say, well, that's a lot of money. Yes, it is, and you're responsible for that every single time. The only time you will get to your coinsurance here is if you're in the hospital for a consecutive 61 days. If you hit day 61, then you start paying $304. And then here, days 91 through 150, consecutive, again, that's the important term, you're now in your lifetime reserve days. You only get 60. After you use that 60, anytime you're in the hospital past 90 days, you're going to pay 100% of the cost after you've used up those lifetime reserve days. Then you have your skilled nursing facility care. Basically, you pay $0 for the first 20 days. And then if you're in there for days 21 through 100, you'll begin to pay $152 per day. And again, these are consecutive days. After day 100, you become solely responsible for your care in a nursing skill facility. Okay? And then again, there's the information about the blood and how it actually works. First 3 paints are covered at 100%, and then you have 20% coinsurance for each additional paint that you use after that. Then for home health care, of course, you pay $0 for home health care, but anytime you have to use equipment or durable medical equipment, you're responsible for 20%. Remember, original Medicare, everything is 80-20. So if you have COPD and you have that tank, you have the mask and the tubing that's connected to it, you're going to have to pay 20% for that equipment that is connected to that oxygen tank that you need. And then you could pay up to $5 co-payments for outpatient prescription drugs. Basically, that's medication that you're getting filled because you're not actually in the hospital. You're going to be at home receiving this care. You could pay a $5 copay. And another thing that's very important here, I'm sorry, I hate to go back, you have to make sure your providers accept assignment. Accepting assignment protects you from being charged excess charges. You know how when you're working and say you have Blue Cross Blue Shield, you go to the dentist. They say, well, we're going to charge you for your office visit, but you also have a copay. But in the real teeny tiny print on the bottom that nobody ever reads, because I don't, but it says once we bill your Blue Cross Blue Shield, whatever they do not pay for, we're going to now bill you for it. If your doctors accept assignment, that protects you from being billed whatever Medicare does not pay. So that means now that provider has come into agreement with Medicare. If we're going to charge $100 for the service, but we're only going to make the Medicare beneficiary responsible for $50. Anything else that Medicare decides they're not going to pay for, you only pay that $50 and nothing more for that service that you've received. So that is very important when it comes to original Medicare or Medicare Advantage plan. You always want to ask, not only do you accept Medicare, but do you also accept Medicare assignment? And that is going to be either a yes or a no. And if you're going to a provider that is working with Medicare, or they're a provider of Medicare, they should know what assignment is. And normally you still may want to talk to someone that's going to be pretty much in their billing office or handles the insurance. Don't ask the doctors because they don't know, okay? And then, of course, you have hospice care that is also going to be covered under the Medicare Part A. It's going to be 5% that you will be responsible for inpatient respite care. And respite care is basically where somebody is kind of given a break in order for the caregiver to be able to do other things. So that means they'll take care of the beneficiary that's receiving the services, but it will kind of give them a break or alleviate them to be able to go do some other things. But they only make you responsible for 5% of that cost if you decide to do the respite care. And then in some cases, you may end up having to pay for room and board, but usually if you're inpatient, it should be covered, okay? And then you pay a $5 fee for the prescription drugs. That is the co-payment for prescription drugs while you're in hospice. And then you have Part B, which is going to be your medical insurance. Part B is going to cover doctor services, outpatient medical and surgical services and supplies, diagnostic tests, outpatient therapy, outpatient mental health services, and it says some, but I'm not going to say some, and preventative healthcare services. So we're just going to put an X and scratch that out. And then other medical services as needed. The preventative services under Part B is going to be the Welcome to Medicare exam. That's going to be an exam that is free to you, and it allows you to meet with the doctor in order to say, hello, I'm new. How can we go about setting up my treatment plan for how you're going to take care of me? This is what I have going on. It's just a way for you to really build a rapport with your doctor. This is not to be confused with the yearly wellness exam. The yearly wellness exam is going to be your physical that you get every year. So we have seen a lot of the times that Welcome to Medicare exam, it has actually been billed as the yearly wellness exam. It has a lot to do with the way doctors or the provider's offices actually code the visit. So if it's a Welcome to Medicare exam, You want to make sure you say, well, no, this is not my wellness exam. This is not my physical. I want to take advantage of my Welcome to Medicare exam, where I can come in and talk to my doctor about what I have going on, and we can set up some different things about how he's going to manage my care and take care of me. That's what you're able to do as a beneficiary. You have that right, okay? And then you have a lot of other things up here, the abdominal aortic aneurysm screening. That's another preventative service. Bone mass measurement, cardiovascular disease screenings, diabetes screenings, flu shots. I won't read them all, but all of these are going to be preventative services covered by Original Medicare under Part B. Right now, when you go to your doctor's office, you should have a $0 fee for having any of these preventative services or screenings provided to you. You should not have to pay a co-insurance or anything for these visits, okay? The Part B monthly premium. This is a fee that is associated with having Medicare Part B. It is going to be based on how well you have done. They're going to look at 2 years. Well, it's 2014, so they're looking back to 2012. And they're going to look at how much you have made during 2012 and 2013 to determine how much you're going to have to pay for that Part B. Typically, everybody pays the $104.90. But if you have done very well, those totals can begin to increase. I had one gentleman that worked in 2012. He didn't work in 2013, but in 2012, he was kind of down here. And he said, why am I having to pay so much? And I've never heard of anybody paying that much money. And I'm like, well, because you made, that's what they're looking at. They're looking at how much money you've actually made within those couple of years. I said, now it will catch back up with it, with itself. Once 2015 comes along, now they're going to look at 2013, 2014. It's sad to say, but as long as you don't work in 2014, now your premium will go back to that $104.90. But if you work, they're going to look at your income. So he was kind of upset about it, but I'm like, that's the way they have it set up. I would give it to everybody for $104.90 or for free if I could, but I don't work for Social Security or Medicare. What you pay for original Medicare for Part B, you have, again, deductible. There it is again. Part B does have a deductible outside of that premium. That premium you pay every month. Typically, it comes out of your Social Security check. But the Part B is $147 per year. And then basically, it will be paid for as you go and have your doctor's appointments and visits. They will have you paying for it kind of as you go along. Once you pay it, you only pay it once. And you don't have to pay it again for the rest of the year once you actually meet it. Then you have your Part B services. Remember, I said everything with Original Medicare is 80-20. So again, there's that 20% co-insurance for most of your services. Any services you have, you're going to be responsible for 20%. Then when it comes to outpatient mental health, you have a 20% co-insurance. And then, of course, your co-payments or co-insurances for the hospital, which is what I showed on the previous slide. For those days that you go into the hospital for consecutive amounts of time, those are going to be your co-payments or co-shares for that. But for Part B, you have co-payments. If you go into the emergency room, that's going to be considered to be an outpatient service. So they will tell you how much you would have to pay for that visit while you're there just on the emergency room, but they send you back home. You're not there past 24 hours. They take a look at you, you say you're okay. The only time when the observation days come into play is if you're there past the 24 hours and it's still considered observation. But if you go in, you're there 23 hours or less, it's going to be basically a copay for going into the hospital, and it's going to be outpatient services covered under your Part B, okay? And then again, you always just want to make sure that your providers accept assignment, no matter what. If they have labs that they use, it's okay to ask, does Quest participate and accept assignment? You want to know that because you don't want to go to your doctor, have your blood drawn, they send out all this blood work, and then next thing you know, you're getting a bill from Quest, and you're like, no, I have insurance. Why am I getting a bill? I would ask the same question. Well, Quest does not take Medicare. I mean, I know they do, but just for example, if they say they don't, then you have a bill that you're responsible for because Medicare is not going to pay for it because they do not participate with Medicare. So it's always important to ask that question anytime you're receiving services with your Medicare. What does Medicare A and B not pay for? They do not pay for long-term care, which is going to be a nursing home, routine dental care. However, there are some exceptions. I have a background where I worked in oral surgery for about 7 years. There were a couple of times I could get some beneficiaries covered and get their dental work covered, meaning extractions, nothing cosmetic, but just extractions. But it was all because they could not sit in an outpatient or in a clinical setting. Treating them in the chair in the office was basically detrimental. It would be basically life or death. We were able to get some approvals to do their work actually in the hospital. The work was covered as well as the visit to the hospital was covered. The Part A actually kicked in. So that's why I say some exceptions, but it is not easy to get that done. It's going to take a lot of hard work on the office that you're going to get that taken care of. But usually, typically, they do not cover any routine dental care, okay? Dentures are not going to be covered. Cosmetic surgery is not going to be covered. And then also some exceptions, if you're like in a very bad car accident and you're disfigured, Medicare may step in and provide some coverage in order for them to, I guess, put you back together. But again, that's going to take a lot of paperwork to get Medicare to go along with it because it is not something typically that they cover. Acupuncture is not going to be covered. Hearing aids and exams for fitting for hearing aids are not going to be covered by original Medicare, okay? And then you have your Part A and B automatic enrollment. Typically, if you're at the age of 65 and you're retiring, you get your retirement benefits, you will be automatically enrolled. I have had some people say, well, I'm 65 and I haven't received anything. I don't know why there's such a huge gap. I have some people say they were. I have others say that they were not. If you see several months before you're getting ready to turn 65, you haven't received anything in the mail, that is the time that you need to get on the phone and actually call Social Security because something is wrong. I'm not going to say wrong, but you may be one of the few that are not going to be automatically enrolled. Calling Social Security is a mess. I do know. I end up on hold for 2 hours or more, and I'm like, I cannot believe they're putting me on hold, and I'm trying to help somebody, but it does happen. But that is the only way you can actually take action to start any type of enrollment or accepting of your Medicare benefits. That's where everything starts with Social Security, okay? And then if you're under the age of 65 and you're disabled, you do have to wait 24 months before they provide you with any Medicare benefits. But the 25th month, you should automatically be enrolled, and now you're able to make decisions about going with a prescription drug plan with original Medicare or deciding if you want to go with the Medicare Advantage plan. And then anyone else would have to basically enroll themselves if you're not automatically enrolled. Enrolling into the Part B, of course, automatic enrollment if you're receiving Social Security or railroad retirement benefits or disability. And then you have the initial enrollment period, which is going to be a total of 7 months. So you have 3 months before the month you turn 65, the month you turn 65, and then 3 months after you turn 65. That is all the time that you have in order to make a decision. The best time to make your decision is going to be within the first 3 months, because within the first 3 months, that's to ensure that your benefits start exactly on the first day of the month that you turn 65. If you make the decision the month you turn 65, you're going to begin to delay the start time of your benefits a month every time that you wait, okay? and if your birthday is on the very first month. I had no idea that this was so. I have not seen this written, but I actually called Medicare because I had a beneficiary call, and she said, I have to make a decision right now today. We were not in open enrollment. She was in her initial enrollment period. And the very last day for her to make a decision was December 31st. So she was told by Medicare. But when she told me when her birthday was, I'm like, no, you have until January the 31st. Her birthday fell on the very first month that she turned 65. So her initial enrollment period started a month early. So instead of the 3 months before the month she turned 65, she actually started 4 months before the month she turned 65. So if your birthday is on the 1st, always know that it's going to start a month early, as opposed to the usual 3 months before, the month of, and 3 months after. That is very important. I see a lot of beneficiaries not know that, and then they're in a frantic because they have to learn about all of this in less than a month, which is almost impossible. And then they want somebody to actually make the decision for them. At SHIP, we cannot make the decision for you, as much as I would love to and say, no, I can't do that. I can only share with you how it works and how it will impact you based off of the decision that you make. So that is very important to know when your initial enrollment period is going to start and when it's going to end. And then, of course, you have general enrollment, which is also called GEP. It's going to be January 1 through March 31st of each year. And this is going to typically be for anybody that did not enroll during their initial enrollment period. Whether they declined and just decided, I don't need it, I don't want to pay for it, or I can't afford to pay for it, this is when they will have to enroll into Medicare during that time. And then their benefits would become effective July 1. However, whatever has caused them to not enroll when they were first eligible, they could also incur a 10% penalty, 10% for every 12-month period that they decline. But then there are some special circumstances. For instance, if you turn 65 but you continue to work, you will not incur that penalty because you're able to waive enrolling into your B and your D without any penalty, okay? And then again, this is just another chart just to kind of show you how that 7-month initial enrollment period works. These are the first 3 months, the month of, but then you can see it's now in the red because it delays the start date of your benefits. It's just to kind of show you exactly how it's set up. This is actually going to be in your Medicare New Handbook, this exact diagram. And then you have your Medicare Part D, which is the third component of Original Medicare. It is available to anyone that has Medicare, whether it be original or it be with the Advantage plan. You have the prescription drug plan available to you, okay? Medicare Part D drug plans, the costs are going to vary by the plan because these plans are going to be offered by private insurance companies. So when you're basically automatically enrolled or you're receiving your benefits, you're going to get the A and the B, but this is the portion that you have to act on. If you're deciding to go with original, this is the piece that you have to choose to go with besides deciding to go with an Advantage plan. So basically, if you call SHIP, we would do a plan comparison to help you decide what prescription drug plan will be best for you based off of your medications. But we'll be looking at all private plans. It's going to show what your monthly premium is when we do that plan comparison. On average, a plan could cost you about $35 a month. The cheapest I have seen for 2014 is about $12.40. Like I said earlier, there will be a deductible, not always, but sometimes, and the maximum is going to be about $310. And then you have co-pays or co-insurances for your prescription drugs. Typically, you're going to have a co-payment unless that medication costs a lot of money. It's very expensive. Then they can choose, and when I say they, I'm speaking about the pharmacy and the health plan. They can basically decide if you're going to pay a co-insurance or a percentage of the cost as opposed to paying that dollar amount that you're used to seeing when you go get your meds filled. And then you have an out-of-pocket spending limit, which is $4,550 for 2014. Basically, this is the amount that you, as well as the plan, have paid out of pocket for your prescription drugs, okay? Once you pay this out-of-pocket amount, basically this is the beginning of your donut hole. A lot of people are like, well, everybody hits the donut hole. Everybody does not. But depending on how much your medications cost, you could hit that dollar amount. Once you hit that dollar amount, you're going to become more responsible for the cost of your drugs. You'll become responsible for 79% of the cost for generics, and then for brand names, I think it's going to be 47.5%. That's what you'll begin to have to pay until you get to what they call catastrophic coverage. And basically now you've paid, I'm not good at math, whatever this half of this amount is, once you've now paid that, then that's when you'll hit catastrophic coverage. And then they will drop that dollar amount down to the lowest they can so that you don't have to continue to pay those high percentages for your meds. But there is light at the tunnel because they have extra help. Extra help is based off of your income and your resources, but it keeps you from hitting the donut hole. If you have a monthly premium, it could take that monthly premium down to $0 a month, or if you have a plan that has a $110 monthly premium, it could take it down to $40. I've seen some go down to $6. But it depends on how much assistance you're receiving from extra help. That's going to determine how much you will pay for a premium or for a deductible. But typically, it takes those amounts to zero, and then it reduces your copayment for your medications to where your generics will cost no more than $2.55, and then the brand name medications would cost no more than $6.35. In order to actually apply for this program, you go directly through Social Security in order to do so. But at SHIP, we actually have the paper application. It's hard to get them, but we have them. I have to fight to get them every year. They're like, well, we don't send them out. Yes, you do. And I have to tell them their process in order to get them. But there is an application. Social Security will do it for you over the phone, but then we also have the access to do it online for you as well, as long as you don't have any issues with sharing your information, because we have to ask all of your information over the phone in order to complete that app online. It's a really good program though, and I tell everybody to apply. So what if your income falls over by $50, $200, apply, let them tell you no before you not try. Because if you don't get 100% assistance, you could get 75%, 50%. I've seen some people get 25%. Anything less than 100% is going to be considered partial, but any type of assistance will keep you from reaching that donut hole, okay? And then once you have it, if you see you have added medications in the middle of the year, you have a continuous special enrollment period where you can change your prescription drug plan at any time if you see it's no longer working for you. So this is a really good program because you have flexibility once you are deemed eligible for extra help. When can you join or switch a Medicare prescription drug plan? Again, during your initial enrollment period, when you're first eligible, that's going to be when you can join. Choosing a prescription drug plan during that time, basically you're saying, I want original Medicare, okay? And then you have annual enrollment, which is right around the corner, which is October 15th through December 7th. It's every year. You can switch your prescription drug plan at that time. And then for Advantage plans, you have January 1st through February 14th, where you can also make an additional switch, because during AEP, October 15th, you can go from original Medicare with a prescription drug plan to a Medicare Advantage plan, or vice versa, from a Medicare Advantage plan to original Medicare and pick up a prescription drug plan. And then you have the option to now pick up a Medigap policy if you choose. But say for instance, now January 1 through February 14th, you're like, yeah, I'm in this Medicare Advantage plan, but I prefer to go back to original Medicare. They're going to give you an additional period to where you can go back, but you can only go back to original Medicare during January 1st and February 14th. And then there's that special enrollment period that I was speaking of when it comes to extra help. But there are some other situations or circumstances that will allow for you to have a special enrollment period. If you permanently move out of your planned service area, you will be given a special enrollment period to pick up another prescription drug plan. If you lose your credible prescription drug coverage, remember earlier I said if you turn 65 but you still continue to work, you waive your Part B, you waive your Part D, you're not going to get a penalty for waiving it, but now say you decide I'm going to go ahead and retire and it's 2 years later. You will be given a special enrollment period to actually pick up that prescription drug plan because the prescription drug coverage you had through your employer health insurance is now going to end. That's what losing your credible coverage is when it comes to prescription Part D here. And then if you were not adequately informed that your coverage was not credible. So if you do have insurance and it's through employer, and you do not receive that letter or they do not tell you that they've lost their credible coverage, I guess, standard or rating, and you're not informed, then you could be allowed to have a special enrollment period because of that. Meaning they did not tell you and you were not aware, because now that means you're going to be held liable for a penalty because that coverage was not credible. But Medicare is saying we're not going to hold you responsible because they did not do what they were supposed to do, okay? And then if you live in, enter, or leave a long-term care facility, again, long-term care being a nursing home, you will be given a special enrollment period to pick up prescription drug coverage. And then now we have the fourth component that makes up original Medicare, but it is optional. This is the Medigap policy or Medigap supplemental insurance, not to be confused with an Advantage plan. Medigap policies are going to be for any Medicare beneficiary that has Medicare, but they are on original Medicare. Medigap policies are going to be sold by private health insurance companies. Then the private insurance companies also have to be licensed by the state that you're in. So if you're living in the state of Tennessee, someone in Kentucky cannot sell you a Medigap policy. The insurance companies that are able to sell Medigap policies in the state of Tennessee, we have a list of people or companies that are able to do so. But someone from another state cannot sell you a Medigap policy if you're not living within that state. And then what does Medigap do? It actually supplements original Medicare. When I say supplement, that means that 20% that you're responsible for, once Medicare pays their 80% share, they're going to help you pay your 20% share of the cost so that you do not have to pay that 20% out of pocket. But it will depend on the type of Medigap policy that you choose to select, okay? And then again, the companies that offer the Medigap policies, they do have to follow federal and state laws in order to protect you as the Medicare beneficiary. And again, they must state that they're Medicare supplemental insurance, okay? Some people will say, well, I already have. If it's not a Medigap policy and it's not labeled as a Medigap policy, then it won't supplement Medicare, okay? Because there are a lot of different private policies that are out there that you can purchase, but this is the only one that will supplement Medicare if you are a Medicare beneficiary. Medigap policies do not cover everything. So anything that Medicare does not cover, your supplemental policy is not going to cover. So if your Medicare does not pay for dental, it's not going to help you pay your portion for dental work. Say for vision. Now I know Medicare will cover vision in instances where you have cataract surgery and different things like that. They will cover your surgery and your eyeglasses and your contact lenses or whatever appliance you need after that surgery. But typically, they do not just necessarily cover vision. So if Medicare says we're not going to cover that service, then your Medigap policy is not going to pay for it. Because at that point, it's basically not going to be cost sharing if Medicare does not pay their part. Okay? And then if you buy a Medigap policy, the policy pays all or part of your share. But again, that is going to depend on the policy that you choose. And the coverage depends on the Medigap plan you buy. That's the most important thing when you're choosing or deciding to purchase a Medigap policy. You have to make sure that you understand the benefits that that plan is going to cover and how much they're going to cover in terms of those benefits. And then again, this is just a list of some of the things that are typically not covered by Medicare and Medigap will not step in and help pay for. Long-term care, vision and dental care, hearing aids, or fitting for hearing aids, and private duty nursing. Those are not going to be covered by Medicare, nor will they be covered by Medigap. And then this is just a diagram that shows you all of the Medigap policies. They're going to be labeled by alphabets here. And then these are all of the benefits listed down the side. And then it will show you how much each of those plans, or what percentage those plans will pay for these benefits here on the side. I won't go through all of them, but if you see a column is empty, then that means that policy does not cover that particular benefit. You have F, which is going to be the most comprehensive. This one here with the asterisk beside it, that's going to be the one with the high deductible. And I think that deductible may be like $2,140 for this year. But that means now you have to pay that before that actual Medigap policy begins to help you pay for your cost or your share. But they do have a Plan F that does not have a high deductible. I don't know why they don't advertise both, but they always put the one with the high deductible on the diagrams. Every diagram I find, it has the one with the high deductible. And it's the most comprehensive because it covers all of the benefits at 100%. But you do have the option to go with a high deductible or the one with the low deductible. But the one that is listed here is the one with the high deductible. And then you have plans. Let me see if I can get the pointer on it. You have K and L. These plans are going to stand out a little bit more because they do not cover all of the benefits at 100% like the others. You have K that covers at 50% and you have L that covers at 75%. But then also they have an out-of-pocket limit. I could not alter this chart here, so I put it on the bottom. They actually have out-of-pocket limits for K. It's $4,940 for this year. And then L is $2,470. So that means once you pay that percentage or that amount, I won't say percentage, that's incorrect. Once you pay that amount out of pocket, those plans will now cover your services at 100%. But you have to reach that out-of-pocket spending limit before they start covering at 100%. If you never reach it, then that's when they're going to pay, say for your Part B coinsurance, only 50%. If you go with Plan K, or if you go with Plan L, it will only pay 75%. So that's how those work with the out-of-pocket limits being attached. And then now we have the second way that you actually receive your Medicare benefits, the Medicare Advantage Plan. Not to be confused with Medigap. A lot of people call the Advantage Plan supplemental. It is not supplemental. It is very important that you do not get the two confused. I have a lot of beneficiaries that will call me and they'll say, well, I have this supplemental plan with Blue Cross and it's just not paying. And I'm thinking in my mind, because they've said supplemental, you have a Medigap policy that will not pay? What service did you receive? And then they'll tell me the services and I'm like, no, those are covered by Medicare. Why wouldn't they pay for it? Because anything Medicare pays for, your Medigap supplemental policy should help you pay your share. But by the time we continue in the conversation, I realize they have confused the terms. They actually have a Medicare Advantage plan and not a Medigap supplemental plan. Okay, so that's really important. A lot of people say, well, I don't have Medicare. I have Blue Cross. Okay, give me the rest of the, is it HMO or PPO? Do you have a red, white, and blue card? Yes. They do not realize if they choose a Medicare Advantage plan, they still have Medicare. If you go with an Advantage plan, you still have Medicare. So any rights that someone has for original Medicare, you still have those same rights and protections if you go with the Medicare Advantage plan. You have the right to appeal. You have the right to report providers for not providing the type of quality care that you're looking for, or just different things. You still have the same rights that someone has if they choose to go with original Medicare, even with the Medicare Advantage plan, okay? You still get your regular Medicare covered services. Those services are going to be what's under your Part A and your Part B. You still get the hospitalization coverage. You still get the skilled nursing facility care, hospice, home health care. You still get all of those. However, the difference is going to be with the Medicare Advantage plan, it's not going to be an 80-20 split. Instead, they're going to have a different fee schedule for how you pay for those services. It's going to be a copay. Every single one is going to be different. I do not know them off the top of my head. If I could remember all of them, then I would be the expert. And the only way you'll really know how much you would still pay for those Medicare covered services that you normally get with A and B, you're going to have to either have a plan comparison done, and then we could just basically select that button and see all the health benefits, and it'll show you how much they cover and how much you would be responsible in co-payments for the different time frames. Whether it be for days 1 through 20, they will show you how much you're responsible for or what the copay is, or days 21 through 100. They will choose what that copay is, but every single plan will have it set up differently. And then you may get some extra benefits. That's pretty much the reason why they call it a Medicare Advantage plan. Keep in mind, even though you may get vision, hearing, or dental care, it's going to be very limited, but that is pretty much one of the reasons why they call it an Advantage plan, because you can get these, which is something typically you would not get with original Medicare. And then also, you'll be able to get a prescription drug plan. So basically, once we do that plan comparison, if you choose to go the Medicare Advantage route, if you choose Aetna, Humana, Blue Cross Blue Shield, once you make the decision to go with that company, that's going to also be who your prescription drug coverage is going to be through, okay? I only put about 3 different types of Advantage plans up here because these are the 3 that I'm most familiar with and that I see the most. It's going to be the Health Maintenance Organization, which is the HMO. Basically, it's going to be in the center of the bullseye. And then you have the Preferred Provider Organization, which is going to be kind of on the outside of the bullseye because you have a little bit more wiggle room when it comes to these networks. And then you have the Special Needs Plan, which may kind of be here in between the two. And the reason why I say in between the two, because they're just designed specifically for people that have chronic illnesses or diseases. Depending on their health status, they may qualify for a special needs plan. And then those plans can be HMOs or PPOs, but they still have a network that they have associated with them, just like the HMO or the PPO. And then a lot of people will say, once I go with the PPO, I can go to any doctor I want to. And you do, because typically you don't have to have a primary care. But once you begin to work outside of that network, it increases your cost. And a lot of people do not normally share that portion. They're just like, yeah, it's an HMO joint. You want to be able to go wherever you want? That's the plan for you. You can go wherever you want, but they always seem to leave off the part that when you go wherever you want, there's still a network that is associated with it, which can cause which could cause your costs to go up. The HMO, you may not be able to go anywhere you want. You do have to have a primary care in order to go see a specialist, but you're confined to that network, but it helps to keep your costs down. So it's not so much that one is right or wrong. It just depends on which one kind of works for you in your current situation. But again, when we do that plan comparison, we'll be able to see what's available in your area, and then you can make the decision how it will work for you. How the Medicare Advantage plan works, again, you get your Medicare covered services through the plan, all of the Part A and Part B covered services that you get with original Medicare, you still receive. And then you have some plans that may provide additional benefits, which is going to be that vision or dental, and then prescription drugs. And then you may go to a network of doctors or hospitals, which is going to be that HMO or that PPO or that HMO POS. This is very important. The reason why with Medicare Advantage plans, a lot of people will go to a Medicare Advantage plan, but they have not done their homework. It's always homework associated with going this route, because if you have 3 different specialists, you have your primary care, you have Vanderbilt that you go to for some services, but then you may go to Centennial for some other services. You have to make sure that all of them accept your Medicare Advantage plan. If they do not, you cannot use your Medicare Advantage plan there. And a lot of people will be enrolled, and I hate to see this happen, but they're sold on all of the extra benefits, the vision and the dental, which is already limited to the point where it's only something routine. But that is the thing that a lot of agents sometimes will sell their plan with. And if you don't understand Medicare Advantage and how it works, they will change their plan at the drop of a dime, but they have not done the homework to make sure they can continue to go to the same doctors they have, or if they go to the hospital, they can still continue to go to that hospital where they're comfortable. You want to be able to still go where you're able to get the type of quality care that you're comfortable with. But if they don't take the plan that you have, what's the point of having that plan? So you always want to make sure that before you make any changes, specifically with Advantage plans, that they take that particular Advantage plan. You give them the entire name, you can give them the plan ID number, you can share all of that information with them to make sure that they take it before you make a change. That is the most important thing to remember about Advantage plans. And ask, do you accept assignment, to keep your costs low, okay? And then again, your benefits and your cost sharing may be different than in Original Medicare. Original Medicare is 80-20. With the Advantage plans, it's not going to be an 80-20 split. All of their costs are going to be different. The only way you will see exactly what your cost share is if you do a plan comparison, and it will kind of give you an idea of what you will be responsible for, okay? When can you join or switch a Medicare Advantage plan? Of course, during initial enrollment, which is when you're first eligible. This is that big decision. Do I go original and pick up the prescription drug plan and possibly the Medigap policy, or do I go with the Medicare Advantage plan? It's that same month period. This is the first thing that you're going to encounter when you become eligible for your Medicare. And then you have annual enrollment, again, where you're able to make changes October 15th through December 7th, and then that coverage will start on January 1 of the following year. And then, of course, you get a special enrollment period for Advantage plans. Just like you get a special enrollment period for Original Medicare, you also get one with Advantage plans. If you move from the plan service area and you cannot stay in that same plan, then you will be given a special enrollment period to join another plan. All plans that are available within Rutherford County are not going to be the same plans that are going to be available in Dixon County. Their plans may decrease significantly when it comes to Medicare Advantage plans. Now, if you're on Original Medicare, just about every prescription drug plan that's offered in one location is offered in the other. But when it comes to a Medicare Advantage plan, it is not the same. You could have 10 or 12 available here and only 5 or 7 available in Dixon County. So if you have to move from here to Dixon or from Dixon to here, you'll be given a special enrollment period to pick a plan that is available in your area, especially if the one you had in the area where you were before is not available. And then if your plan leaves the Medicare program altogether, I think United Healthcare did it last year, we're no longer going to participate. So that means now any Medicare beneficiary that was on their plan basically lost their insurance, but they were all given a special enrollment period to pick up another plan at that time. It happens, and they did it right before AEP, which kind of made it horrible because it's like now you're going to force your beneficiaries to disenroll or be disenrolled from your plan, and now you have that along with AEP. So it made a lot of people confused because they're like, well, I lost my insurance. And I'm like, huh? How did you do that? And then we find out they had decided to withdraw from working with Medicare. And they do have that option. So no provider or hospital, they're not locked in when it comes to Medicare. They're able to make changes mid-year. It's called basically kind of like a maintenance change. They may change tier 2 medication to tier 1 to where that's generic, which is good because it makes it now cheaper for you, but they can also make changes and move a tier 2 medication, which is going to be fairly kind of in the middle when it comes to a copayment, to tier 3. They're able to make maintenance changes in the middle, which are sometimes going to put beneficiaries at a disadvantage when it comes to the cost of their medications. So there are a lot of different things that kind of go on with Medicare Advantage plans that you have to be aware of because they operate a little bit different, especially since they are private companies. And then again, you get that additional time to change or disenroll from a Medicare Advantage plan, January 1st through February 14th. And then that coverage will begin the first month after you leave the plan. And then if you make a change, you have to remember you can only go back to original Medicare if you take advantage of this. And that's going from Medicare Advantage back to original only. Other than that, that pretty much concludes my presentation. But I just want again to reiterate the annual open enrollment period, which is October 15th through December 7th. This period is approaching very fast. You do not have to make changes during annual enrollment, but it is a good time for you to see what your plan looks like now and what that plan will look like in 2015. It is possible that things can change from the cost of the plan, deductibles, what tier medications are covered in, if the medications are even on the plan's formulary. Those changes you will be able to see if you do a plan comparison with Tennessee SHIP. And that's what we're there for. It's free, it's unbiased. We can't make the decision for you, but any questions that you have, we can say, well, that could work, but you also have to consider this, 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 and this if you go that route. If you choose to go another route, we're going to do the same thing. That's okay if you want to go that route, but you also have to be aware of the different things that can happen if you go that route. And again, that's what we're there for, to help all Medicare beneficiaries, whether you're on Medicare or are new to Medicare. We sit down and help you understand what it is and what your options are. This is coming very, very fast. So again, keep it in mind, kind of make a mental note of it, and just see it floating by in your dreams in orange. AEP, do I need to call SHIP? And then some people will say, well, I don't need to make a change, and that's true. You don't have to, because somebody that's already on Medicare, your plan, if they're going to make changes, they should have already sent you a notice to show you what changes are going to occur. But you can do that plan comparison and put them side by side with other plans to see things kind of black and white. What this monthly premium is, but if I go with another plan, can I still have my medications covered with a cheaper premium? That's what AEP is all about, in doing that plan comparison to make sure that what you're in is still what's best for you. And then I think Ms. D is going to be hosting an enrollment event, so if you want to sign up, sign up. We want everybody to sign up, whether you make a change or not. We just want to make sure that what works now is going to work in 2015.